New York City emergency room would do anything in the world not to go back to New York City emergency room. You know, you kind of can camp out. You can take your sleeping bag. Okay, now it's your turn. So we're going to do Q&A. Speak up, and I will repeat the question for the filming. And here we go. There we go. Please.
Russ Cusick with Swiss Post Solutions. Russ Cusick with Swiss Post Solutions, and for Michael Orpia, you both spoke about the minimum value, and we went on to say 60% of the plan. When we're talking about plans having to have dependents, is that 60% coverage of just the employee, or is that inclusive of the dependents?
That's a good question, and right now...
Pia, would you repeat the question for the filming?
Sure. The question was, in order for plans to potentially escape one of the penalties under the pay or play rules, they have to provide coverage that provides minimum value, which is basically a 60% test. The plan has to pay 60% of the cost of benefits, and the question was whether that 60% of the cost of the benefits for employee coverage or 60% of the cost of the benefits for, I guess, the employee plus dependent or family coverage. Right now, the guidance is not exactly clear on that. At least in terms of providing affordable coverage, they do look at self-only coverage for the employee. That is specifically set forth in the guidance. They are expected to issue future guidance and regulations on that minimum value test, including 3 different methodologies by which you can calculate that. My guess is that it likely will also be 60% of employee-only coverage, just so that there can be a sort of standard way to measure this, but unclear at this time.
Made me think we're going to have to do this panel annually. Okay, next. Oh, there we go.
Elliot Wines, this is more for Joseph. The Accountable Care Organization just really sounds like a gussied-up capitation model from the 90s, which didn't work or didn't stick. Why is this going to be different? How could it be?
That's a really good question,
Would you repeat the question?
So the question was, the Accountable Care Organization seems like just a polished up or gussied up, capitated or HMO type relationship of the past that didn't work. That's the challenge. Is I think one of the things that I would tell you that we watch is, what I'm worried about is, as hospitals are buying doctors right now, which is happening in this marketplace, care is going to get more expensive in the near term because usually when a doctor is affiliated with a hospital, the compensation on a unit cost basis is higher. It'll go up than the individual physician. And then ultimately in the ACO environment, you're talking about giving a population-based payment to the ACO, and in this case, in this market, the hospitals are organizing faster than the providers, so the hospital is going to get the money first, and then it's going to trickle down towards the provider community. And I think that's going to be the challenge, because it's going to be hard to do it. But yes, it is capitation. I think the issue here, and what I like seeing is, as providers organize, they are beginning to hold hospitals accountable. And the key here, folks, it's not that hard, is if you keep your people out of the hospital, your costs will go down. I mean, it's that simple. The costs of hospitals, in this market, a hospital that is not for profit just means they don't pay taxes. It doesn't mean anything that they run themselves to look unhealthy. They are for-profit machines, and they run themselves to make it look like they have an issue. So you're right, and people are going to have to, what's not being talked about in this is that people are going to have to make selections. I can tell you there's a lot of discussions behind the scenes about getting people to choose a primary care physician again. And that's not a popular thing. So when this all plays out, because that's the only way you can attribute a patient to a practice and then track them through it.
Let me build on that a little bit. An ACO isn't exactly the same thing as an HMO. And the fact that you put a label of ACO on a provider doesn't make them good. Everybody's talking about ACOs. It doesn't, so that's kind of the skeptic in me. The more positive side in me is that, we don't fix healthcare unless we fix delivery. This isn't going to get fixed on the back of consumers. It's going to get fixed on the back of consumers and providers. And without changing the incentives in the system, we're going to keep getting the same thing. this isn't exactly the same as the old capitated model. If you think about it, if you look at how Medicare is structured around ACOs, they don't force you in Medicare, for example, to go to this particular provider. They kind of look back and look at where the predominance of your care was delivered and then attribute you to that doctor. So it's a little bit different model than the old capitated model, if you will. You know, if you think about how we as HR professionals design compensation systems for our people, we try to design them in a way that are kind of a balanced scorecard, right? That look at all the different pieces. I think what we're trying to do here is get to a balanced scorecard for providers as well. And the fact that they meet, you know, that they have new incentives doesn't make them well. I heard somebody the other day say, you know, you got to be careful of these ACOs. They're all the high-cost providers. Well, that's, you know, you got to dig through it a little bit. But having said that, I don't think there is health reform without payment reform, and ACOs are our next best effort towards moving in that direction.
Thank you. Okay, someone over here had a question? There.
Deborah Carr, AXA Art Insurance. My question might have a very, very short answer, and for very few of us in this room, but the question is, how does the healthcare reform affect employers of less than 50 employees, if at all?
You want to
Mike?
take it regulatory?
Sure. The question was, how does healthcare reform affect or impact employers that have less than 50 employees? And the question is, with respect to what I discussed specifically, the pay or play rules, it has no impact. You will not be subject to the pay or play rules. But you may be subject to some of the other insurance market reforms under healthcare reform.
And if I could just add my comment on the employers dumping coverage, that's my fear, is that because under 50 employees, there's really not, you know, depending on the type of employer, if it's an employer that's got, you know, 30% turnover and they're not valuing the employee, you know, there might be an incentive to say, you know what, we're out of the health insurance game, you know, go to the exchange. And that you know, I think that's a real thing to be thinking about. And I can tell you, I know a few people that own small businesses that are saying this is just too complex, and, you know, I'll give everybody a few $1,000 raise and let them go figure it out in the exchange.
And actually, let me just clarify that, because if you are a small employer that is a member of a larger control group, you potentially could be impacted if you have a combined total in that control group of at least 50 full-time employees. So for instance, in your example, let's just say you have 40 employees, 10 of which are full-time, and combined within your control group, you guys have in excess of 50 employees. You would be considered an applicable large employer, so you would be subject to these rules, but the penalty amount will be calculated and based only upon your 10 employees.
I'm just giving the control group thing, because people can't divide into subsidiaries in order to get around the rule.
Right, right.
Yeah, can you?
That you can't, you look
It's
at
a
it on a
secret.
control group basis. You can't divide into subsidiaries or sort of chop up your business or your company to try to get around the rules. You're looking at it on a control group basis.
Got one in the back.
Okay, in the back? Yes.
I just want to know what really is the rationale behind the Cadillac tax on generalist plans, other than healthcare reform needing to be funded? It seems as though we're being penalized for offering a quote-unquote generalist plan. So what is the no rationale behind that?
You're being penalized for offering an
Repeat the question.
The question is, why are we being penalized through the Cadillac plans for offering a very generous plan? And the answer is because you're being penalized for offering a very generous plan. More seriously, there's a couple of key drivers in my opinion. One is revenue. You know, this is a very expensive act. And when they look to try to balance the books, if you will, on the act, they have to look for places to pay for it. And the tax exclusion on health coverage is a very rich thing. And in fact, you even hear today when they talk about deficit reduction, they always bring up the tax exclusion as the single biggest tax preference vehicle in the whole tax code. So, secondly, why did they do it through a Cadillac plan tax? Well, eliminating the tax exclusion or capping the tax exclusion was probably politically a difficult sell. So they kind of backdoored it and say, we'll just tax benefits over a certain level, and we'll tax the administrator and let them pass it back to the employer, and we won't call that eliminating the tax exclusion. It's kind of equivalent to eliminating the tax exclusion, much like they do for life insurance. Amounts over $50,000 are taxable to you. Amounts over a certain amount effectively are going to be taxed to you. And then thirdly, and more strategically, I think there is a broad belief that we're overinsured in the country, and that if people had more skin in the game, that would in fact bend the cost curve. I believe that's actually proving out, that we've had a relatively moderate period of healthcare growth over the last few years, and a lot of that has been directly related to efforts by employers to introduce more cost sharing. They're already going in that direction. This is like pedal to the metal. They're going a lot faster as a result of the Cadillac plan tax.
Do we have time for one more or not?
Only if they ask a quick question and have a quick answer.
All right. Anybody have one last quick question? Yes.
I just wanted to know, is there a difference between profit and nonprofit, how they're treated in these plans?
Is there a difference between profit and nonprofit and how they're treated under this plan?
No, all employers are treated equally under the plan. The only difference is, small employers versus large employers potentially.
So you're leaving.
Well,
I'm going to, can you come up afterwards? We're going to lose people here and we have to say goodbye, but thank you.
Okay, thank you so much. Listen, I just have something to say. We have a video on this coming out in just 1 week. You need to watch this again, right? I mean, how can you absorb all of this? What you also need to do is show it to your friends. Send it out to your friends. I mean, are we so lucky that we had this wealth of information and the handouts? When you get the notice for the video, the handouts will be there as well. Make sure that you pass it. Really, I'm just saying you owe it as a gift to your friends and to your coworkers to have them view the video and to also be able to have access to the handouts as well. I cannot tell you how much I thank Celia for her job and these panelists and for all their hard work. Let's give them a round of applause. And thank you, Richard, for reporting on your search, for putting in your 2 cents about us. Thanks. Okay. See y'all in 2 months.
You have a lot of information stored in your
I know, too much. Actually, not enough.
It's